Hi, I'm Lucas Keomany, and I'm here with my wife, Eva Keomany. She works for Capital Colorectal, and I'm going to interview her about her job. So, first, could you tell us a little bit about what you do?
I'm a transcriber.
Okay.
Anything that the doctor dictates, I transcribe from and I document that into the patient's chart.
Okay, and so you work directly with the doctor?
Yes, I do. I work directly under him.
Uh-huh. And how often do you interact with patients?
Not so often. Right now, we're in the process of either a virtual transcriber or going to exam rooms with the doctor and transcribing from that point.
So there's a difference between being in the room with the patient as a transcriber and being a virtual transcriber in another room with a recording device, correct?
Yes.
And so, in society, in like medicine today, is there more of both or more of one? Like, is because technology, is spreading throughout our society, is having a virtual transcriber like more efficient or?
Yes, it can be in many ways.
Okay.
As a virtual scriber, anything that the doctor dictates, you can just work your way along with with a physician or the doctor as he's seeing each patient to patient. And on the other hand, going to the physical exam rooms with the doctor, you can also at the same time be an advocate for the patient, and many times that can be helpful.
Oh, okay.
If you look at it that way.
Okay. I'd like to talk about what first attracted you to working in the medical field.
I have always liked that as very young, and that had always attracted me, and I enjoy it.
Is it everything that you thought it would be?
Yes and no. Yes, because I feel like I am helping people, maybe not directly, but I feel like I have some input in that.
Because you're part of the process.
Yes, and that yes.
Okay. Okay, and so how do you feel working in especially the rectal field? Like, how do you feel about that? Is this where you thought you'd end up?
No, it is not, but it's the start. It's the starting point for my career, and I have a lot to learn, and I love it. Surprisingly enough, before working there, I wasn't really aware of how many people go through with colon and rectal issues.
Yeah.
And there are a lot of people who has problems or issues within that area, and I feel like I see that everywhere now, and it's amazing.
Yeah, and do you see now? What's the trend? Like, what's the specific trend? Are there more older people, or there is it younger people? What kind of?
Yes, most of the patients are older, but I am seeing relatively younger patients because of they have family history of colon cancer.
Okay, so genetic.
So yes.
Okay.
And pretty much, if you have any relatives with a history of colon cancer, you would want to be screened at a younger age to either reduce that or to eliminate, having colon cancer. So.
Could you tell me a little bit about your education? Like, what kind of schooling is required to do what you do?
I took my certification through Ross Medical Education Center in Lansing. It's a 9-month course, and it's a certification, not so much of a medical degree that requires many more years and thorough and specific knowledge of position that you're going for. But here, it covers the very basics of within the medical field, and it's more of an entry-level position, you can say. But
so there's potential to grow in that.
Yes, there is, absolutely.
And what kind of jobs are you looking at as far as like what moving yourself up, I guess, the food chain in the office?
Right now, I am a scriber, and my certification that I went for, I can work both in medical and administrative. So I
Okay.
have a very broad um, um, employment that I can look for.
Okay. Okay, and do you plan to continue your education? Maybe do something else in medicine?
Yes, absolutely.
Okay.
Maybe not specifically medicine, but within the medical field, I would like to go for my PA, physician assistant,
Mm-hmm.
or perhaps nursing.
Okay. Okay. And so you got your certification, correct?
Yes.
And what's the difference mainly between the certification and your degree in the field?
Certification, that is more like a fast track.
Mm-hmm.
Like I said, more like an entry level position, and it just covers the very basic of the medical field,
Mm-hmm.
and it's obviously less years.
Okay.
What I took was about a 9-month course.
Yeah.
So
Yeah.
there's a difference there for sure.
Mm-hmm. I'd like to examine more like the specific medical aspects in the office that maybe you see or you deal with. So what are the more serious medical issues that come into the rectal clinic?
The most common issues with the colon and rectal is hemorrhoids,
Mm-hmm.
and that's very common. A lot of people have that, and it's definitely okay. Many times they're mild, and that can be dealt with in the office. And if in the case of it's more severe, that can be removed. The hemorrhoids can be removed in an outpatient hospital.
So kind of there you do perform surgeries.
Yes.
Not you specifically, but the doctor.
Yes, the doctor is a surgeon, specialist surgeon, you could say. There is. He prefers a colorectal surgeon versus proctologist. Proctologists still mean that meaning is still a specialist of the colon, but
not so much surgery.
He does more than he's a surgeon. So
Yeah.
he's both. He's a specialist and he is the surgeon. So
Okay.
it just depends on what the doctor prefers. Really.
Is surgery the only treatment option available in the office?
No, it can be done through dietary, yes, supplements, and if it's not sometimes with the colon, it's more of the rectal or rectum, anal. That can be dealt with cream base, that that type of thing. We do get some cases of patients with Crohn's disease, and that's something that's obviously genetic.
Yeah.
And that's something that researchers have not found a cure for it yet, but that is lifelong, and that's something that we just slowly treat to reduce or to keep that the Crohn's disease from coming back.
Very interesting.
Mm-hmm.
Well, thank you for taking the time to answer these questions, and thank you for taking the time to be here.
Yes, thank you.